Hey everybody, it's Mark Johnston from the Burn Center at Regions Hospital in St. Paul. I just wanted to spend a few minutes in this video talking about pediatric burn injuries as they relate to suspected abuse. Thankfully, non-accidental burn injuries in pediatric patients are rare, but we as healthcare providers must always be suspicious of the potential of non-accidental injuries to protect our pediatric population. When assessing a pediatric burn injury, it's important to remember to remain objective. When asking how the burn occurred, listen closely and document exactly what was said. It's okay to use quotation marks in your documentation as long as it is exactly how it was stated to you. Don't be judgmental, as this will only set you up for failure with the person providing the history. Always try to assess whether the story being provided is consistent with the injury pattern. Involve the other experts on your team early. If abuse is suspected, this information needs to be passed on to the proper authorities. If the child is old enough to articulate how the burn injury occurred, it may be helpful to question them without their primary caregiver present. A number of pediatric burn injuries can be accidental and not necessarily abusive. An extensive investigation is often required to determine the exact cause, and you may need to be involving law enforcement. Pediatric burn injuries can be not only traumatizing to the patient, but also to the healthcare providers. Cases that involve non-accidental injuries can be even more traumatizing to the team. We must always look out for our coworkers and continually check in with them as to how things are going. Keep in mind that CISM teams and employee assistant programs are invaluable resources should the situations come up. As stated earlier, abuse cases are rare, but they are tremendous stressors on the healthcare team. Detailed assessment and fact gathering are critical pieces in determining potential abuse. Thank you.